November 1908. In the presence of Trieste's leading citizens, the new San Giovanni Asylum is inaugurated. 30 buildings designed by architect Ludovico Braidotti in a 20-hectare park, with a theatre, a church, and even a small village for ergotherapy. 2 world wars, the cultural and practical failure of psychiatry, and severe overcrowding due to the post-war influx of Istrian refugees result in a steady decline in conditions within the asylum. Designed for a maximum of 400 patients when it opened, in 1970 the San Giovanni Psychiatric Hospital is home to 1,260 inmates. Weak local governments in the 1950s and 60s only compound the existing problems. In the late 1960s, a new left-centre provincial government decides to finally deal with this appalling situation. The new provincial president, Michael Zanetti, appoints Franco Basaglia as the new director of the hospital. Known for his previous work in Gorizia and his widely discussed book based on that experience, L'istituzione negata, Basaglia is seen as best qualified to radically change the management of the institution and provide a new approach to the entire question of psychiatry. The Cold War is still a reality, and only a few miles separate Trieste from the Yugoslavian border. But the border also divides Trieste's population, impacting negatively on many aspects of local life and culture. The provincial government gives Basaglia carte blanche, and from 1972 to 1978, with the help of numerous operators, he transforms the hospital. Basaglia's first act is to hire 30 young and highly motivated psychiatrists, psychologists, social workers and sociologists for his staff. With the help of study grants funded by the province, many French, Spanish and Italian graduate students also arrive, as well as numerous students and volunteers from around the world and Italy who are drawn by the innovative experience taking place. In just a few years, the hospital is completely transformed. It is no longer an area shut off and separated from the rest of society. The first decisive changes are made. The locked wards are opened and the segregated male-female wards integrated. Socialization and communication between patients and operators is encouraged through numerous events. Patients begin to go outside of the hospital, breaking the monotony and prison-like regime of the wards. A bar is opened on the grounds. There are daily assemblies in the wards, while all the operators meet on a daily basis in order to keep abreast of the evolving situation and the changes taking place. Living conditions improve. Priority is given to clothing and meeting the basic needs of patients. Meetings, encounters and workshops encourage freedom of movement and expression. The role of nurses, who previously were little more than custodians, is also radically transformed. Gradually, patients begin to leave the hospital. A 1968 law sanctions voluntary admissions, while patients who are ready for release but who cannot live on their own due to poverty or lack of family are formally released but permitted to remain as guests. The provisions of the 1904 psychiatric law, still in effect, which is based on a logic of control and reclusion, are gradually relaxed and circumvented. Patients slowly recover their physical freedom and civil rights. Citizenship, which was lost through internment, often permanently, is restored. Freedom is therapeutic. The city of Trieste is also involved in the transformation process. San Giovanni plays host to concerts, Ornette Coleman, the area, and theatre events, Dario Fo, Les Comédiennes, etc., in order to break down the barrier between inside and outside. Vittorio Basaglia and Giuliano Scabbia form an extraordinary workshop which produces Marco Cavallo, a large papier-mâché horse that becomes a symbol for the liberation of all asylums. In the name of ergotherapy, patients had always worked in the hospital without pay, performing many tasks necessary to its functioning. But now a real co-op is formed, setting in motion the powerful mechanism of recognizing real work with real pay. The savings and other assets of patients are recovered, while financial grants provide the minimum autonomy required in order to live outside. New residential solutions are developed. Small group apartments assisted by nurses, and a return home for those who have families willing to accept them. User-run residences on the hospital grounds, and unassisted group homes where people can live simply. These and other measures lead to a drastic reduction in the number of inmates, undermining traditional asylum culture and the perception of its necessity. There is the growing awareness that the asylum is unable to respond to patients' needs and that alternatives must be created. While these alternatives are being developed, the focus is on the future. In 1977, 500 inmates still living in the hospital, Franco Basaglia announces the programmed closure of the hospital. All efforts must now be directed towards this goal. Intellectuals and activists, including Jean-Paul Sartre, Michel Foucault, Félix Guattari, and Robert Castel, promote the experience in Trieste through their writings and public debates. In May 1978, the Italian Parliament approves Law 180. The law gives legal form and sanction to the experience in Trieste. No one may be interned in a psychiatric hospital in Italy, while those still in hospitals may remain until suitable alternatives are found. During this same period, 1976-77, the first mental health centres are established in Barcola, Auresina and Muggia. The centres begin to provide care for persons in their own neighbourhoods and homes outside of the hospital. In 1980, the provincial government prohibits new admissions into the hospital and recognises the new organisation which is already in place and consists of 5 mental health centres, open 24 hours, 7 days a week, and an emergency service in the general hospital as provided for by Law 180. The 5 24-hour mental health centres provide hospitality during periods of crisis, or for purposes of respite, etc., and also deliver outpatient and home services. Each mental health centre is responsible for the mental health of a specific territory within the province of Trieste. The co-ops continue to expand and develop. The first co-op, the United Workers Co-op, founded in 1973, is joined by an agricultural co-op, Il Posto delle Fragole, Confini, La Collina and La Piazzetta. The mental health centres, co-ops, group homes, family residences and workshops constitute a new service model which takes root and consolidates itself in the following years. 30 years later, this organizational model is still considered to be the best service model available. In 1979, Franco Basaglia leaves Trieste for Rome. The services in Trieste, directed by Franco Rotelli from 1980 to 1995, and then by Giuseppe Dell'Acqua, continue to reinforce, develop, and perfect this organizational model. In 1995, Franco Rotelli is appointed director of all healthcare services in the province of Trieste, subsequently serving as general manager of the local healthcare services agency from 1998 to 2001, and from 2004 to the present. There is thus an operational, philosophical and strategic continuity in public health care, which takes its departure from the specific area of psychiatry. During these decades of innovation and change, thousands of visitors come to Trieste to witness this experience firsthand. Due to its full and effective implementation of Law 180, Trieste becomes an example for other countries in Europe and elsewhere, proving that it is both possible and sustainable to shut down and work without psychiatric hospitals. During the 1990s, Trieste helps close down the Greek asylum on the island of Leros, following the widely publicized scandal regarding the inhuman conditions there. Trieste also participates in projects in Brazil, Argentina, the Dominican Republic, the Balkans, and in other regions of Italy. The international network created during the 1970s continues to grow and change, maintaining and strengthening ties between Trieste and Italy and the rest of the world. The multitude of specific concrete experiences generates a cultural tension which enables psychiatry to free itself from schemes which are biological, positivist, simplistic or reductive in nature. This ongoing effort calls into question not just asylums, but all total institutions, i.e. those institutions which assume total control of people's lives in conditions of separation, resulting in a sanction of social exclusion and separation from society as a whole for primarily weak and vulnerable persons. The lessons learned from transforming the asylum in Trieste can be applied to institutions for minors, prisons, nursing homes for the elderly, and totalitarian institutions in general. The Trieste experience, which continues today, questions the relations of power existing between physicians and patients, not only in psychiatry, where this power manifests itself in a more extreme and violent form, but in medicine in general. Another fundamental issue is the reintegration of social welfare with healthcare policies. When the individual is seen as a unique person with complex needs, which in many cases and for vast sectors of the population cannot find an adequate response in healthcare or social services alone, such integration becomes imperative. 1978, the National Healthcare Act, Italian Law 833, unites all healthcare services within a single entity. The provinces lose their authority over psychiatry, and public insurance and other entities are excluded from healthcare services. Exclusive competency for healthcare services is transferred to local healthcare units, 1980, and then to local healthcare agencies, 1995. 1998. The Friuli-Venezia Giulia region separates hospital care from community healthcare services, creating two different agencies. The Local Healthcare Services Agency No. 1, Triestina, is formed. It includes the Mental Health Department, which coordinates all mental health services. The agency reinforces all areas of community healthcare services. Their main function is providing alternatives to hospital services. The province of Trieste is divided into 4 local healthcare districts. The districts provide a growing number of specialized medical services, from cardiology to internal medicine, geriatrics to physiatrics within the community, thereby avoiding recourse to hospitals and/or hospitalization. The goals of the Local Healthcare Services Agency are thus modelled on the previous radical experience in psychiatry, which eliminated the hospital completely. With nearly 2,000 employees, the agency meets the healthcare needs of 240,000 inhabitants. Current projects include an oncological social centre, a cardiovascular centre, 4 centres for diabetes, structures for rehabilitation and minors, and medically assisted residences. The development of multifunctional services also helps to reduce dependency on hospitals. In addition to the local healthcare districts, The departments of prevention, dependency and mental health help shift services away from hospitals and into the community. Together with GPs, these structures provide an important network of community services which can deliver healthcare services in the person's home or, in any case, outside of a hospital setting. From 1971 until the present, from closed structures to community services, this transformation, though rarely simple or linear, has had the central aim of providing care for persons in their own habitat, with equal access and rights for all, no one excluded. None of the changes that took place over the last 40 years occurred without contradictions or conflicts. Nothing was given freely or taken for granted. Each step forward required the commitment of all, and especially the political, cultural, physical, emotional, and ethical commitment of the operators. Today, this commitment is being denied as never before, and yet it increasingly appears as our most important asset for the future.